For ulcerative colitis, a description of the disease process is edema and inflammation of the rectum and sigmoid colon may expand the length of the colon. Mucosa and submucosa are affected and may abscess. Bowel obstruction may occur. Intestinal mucosal cell changes may cause colon cancer or insufficient production of intrinsic factor, resulting in insufficient absorption of vitamin B12. Risk factors are genetics, culture, Caucasians, and Jewish heritage, gender and age. The incidence of ulcerative colitis peaks at adolescence to young adulthood, most often in females, and older adulthood, most often in males. Diet. A diet low in fiber may predispose a client to ulcerative colitis.
Subjective data for ulcerative colitis includes abdominal pain and cramping, often the lower left quadrant pain, anorexia and weight loss. Objective data includes fever, diarrhea, up to 15 to 20 liquid stools a day. Mucus, blood, or pus can be present. Abdominal distension, tenderness, and firmness upon palpation. High-pitched vowel sounds, and rectal bleeding.
Laboratory findings for ulcerative colitis: hematocrit and hemoglobin are decreased, ESR is increased, WBC is increased, C-reactive protein is increased, platelet count is also increased, serum albumin is decreased, PANCA is increased, stool for occult blood may be positive, potassium, magnesium, and calcium may be decreased. Diagnostic procedures may include abdominal X-ray and CT scan, barium enema, colonoscopy and sigmoidoscopy. Nursing actions: monitor post-procedure for manifestations of bowel perforations, rectal bleeding, firm abdomen, tachycardia, or hypertension.
For client education, before the client goes in for a colonoscopy, we're going to instruct the client to remain NPO after midnight and provide bowel preparation instructions. We're going to inform the client of possible abdominal discomfort and cramping during the barium enema. Nursing care, we're going to instruct the client to seek emergency care for signs of a bowel obstruction or perforation, such as fever, severe abdominal pain, or vomiting. Instruct clients who have extreme or long exacerbations that NPO status and administration of TPN promotes bowel rest while providing adequate nutrition. Educate the client to eat foods high in protein and calories, low in fiber. Assist in identifying foods that trigger clinical manifestations. Instruct the client to avoid caffeine and alcohol and to take a multivitamin that contains iron. Advise the client that small, frequent meals may reduce the occurrence of manifestations. Inform the client that dietary supplements high in protein and low in fiber may be used. Monitor for electrolyte imbalance, especially potassium, because diarrhea can cause loss of fluids and electrolytes. Monitor I&O and educate the client regarding the use of vitamin supplements and B12 injections if needed.
Medications for ulcerative colitis may include anti-inflammatories, corticosteroids, immunosuppressants, immunomodulators, and antidiarrheals.